Committee for June 22nd, 2020. And we have a few policies on the agenda today. We're going to start with suicide prevention, which is a new policy in response to statute SB 52 Addies Act. We'll then talk about policies that are currently in the public comment period, workplace harassment, and search and seizure. Then we'll talk about OSBA policy revisions and how we want to proceed with that. And then staff updates on Title IX regulations that have changed because of federal action, I believe. And wrap up with public comment. Do we know if we have anybody wanting to make public comment?
I haven't heard from anybody.
Okay. Can you let me know if anybody anybody contacts you over the next, hour and a half or so?
Yeah.
And just let me know if I need to make space.
Okay.
Okay. So hopefully Amy will join us soon, but let's start with the suicide prevention policy. Amy, you want to take it away?
Yeah, so I'm Amy Rona. I work in the Department of Student Success and Health, and I help support mental health services district-wide. And I have a couple of colleagues here with me today.
Hi, everyone. My name is Mila Rodriguez-Adair, and I also work with Student Success and Health Department as a district-wide school social worker. And my focus within the department is specifically supporting PPS staff, students, and families in regards to students of color, LGBTQIA+, young adults, and implementing Senate Bill 52, so suicide prevention, intervention, postvention strategies and supports across the district.
James, do you want to introduce yourself as well?
Of course. Hello, everyone. James Loveland, Senior Director of the Student Success and Health Department. Glad to be here tonight.
So we had sent the group, neither Mila nor I have done this before, so we've been working with Mary Kane, and we had sent Roseanne the documents connected to this policy. So rather than being repetitive, what makes sense for this group? For us to do an overview, or for you to start with some questions? What would be the most helpful?
And we asked that because we were told that we have about 20 minutes. And so we wanted to be mindful of the time that you all have given us today and all the documents that we sent over to you as well.
Well, we have a little bit more than 20 minutes, so we can discuss. I think it would be helpful if you started off with kind of an overview. What's the genesis of this policy and kind of the scope of the problem, both nationally, locally, and in particular within PPS that you're aware of, and kind of what the requirements are from the legislation, and how the legislation or the requirements under the legislation differed from what we were doing before. So kind of a general overview, and then we can get into the actual language of the policy.
Okay, so this policy was initiated by Addie Staub's family. Addie was a transgender student who attended Portland Public Schools and died by suicide in 2017. Addie had written in an English essay some pretty concerning information, and at that time Addie's teacher did not let anybody know that, did not reach out to anybody, and Addie died, I believe, a couple of months later. So her family really sees this policy as an opportunity to make sure that all staff have some level of training so that kind of thing does not happen again. We have been engaging in suicide prevention, intervention, postvention work without a policy for several years. We already have a lot of these things in place. And so we are really hoping to build on all of the work that's already happened over the last several years, making it more culturally responsive, getting more feedback from students and families, getting additional training out to staff. We know from our youth risk behavior survey, YRBS survey data, that we have high numbers of students continuing to feel disconnected from school, and that's a huge risk factor. We know that our LGBTQIA+ students, who's a group that is specifically named in this Senate bill, are feeling extraordinarily disconnected, and that they have higher rates of planning for suicide and higher rates of attempts. We also know that our students of color don't have high levels of connection with within their school buildings, and those students also have higher rates of attempts and identify planning more than our white students. Mila, what else would you like to add to that?
Sorry, I wasn't unmuting on, I don't know why. Also, in regards to that, Amy and I have done a significant amount of an inventory back in the fall to gather data, knowing that data is important to address and implement an intervention. For anything, we need data to kind of give us a picture where we're at. And so in the fall, we did provide a suicide prevention intervention strategy. Sorry, there's something else going on behind me, so I apologize for that. In strategies to implement that. So in that inventory, we were able to get a current picture of where we're at as far as prevention strategies, intervention strategies across PPS school district. And we also were able, at the end of the year, we were able to collect and gather the data as far as the total suicide screenings that we have that included race and ethnicity, and if a student identified as gender non-binary or not. And so we also have that information to work from to assure that we are implementing Senate Bill 52 with the best regard and addressing racial equity and social justice matters within this bill.
Thank you, Mila. So this calls for a screening process, which we currently have in place. It calls for prevention curricula, some of which we have in place through our psychs, social workers, counselors, and our health classes, but we will continue to build on that. It calls for really, again, specific intervention and prevention services in connection to our historically underserved youth, and that is where we really need to build out our work. As well as we currently have our psych, social workers, and counselors being trained up and doing a suicide screening. We do not have a generalized mental health training district-wide for all staff. And that's where, again, to reiterate, where Addie was failed. And that's where I think we have a real opportunity to build out the capacity of our staff, because this is not a psych, social worker, counselor responsibility. This is a responsibility of our entire community. So we have started to do some of that work. I did a campus security agent training in 1-hour suicide prevention training with them last year. Nutrition Services, Whitney, has said that we can get in front of those folks this year. So we will continue to build that out with those staff who are interfacing with our students and have strong relationships with our students. But our teachers are really a group that we need to be able to get in front of to make sure they have the information they need to support our community.
Well, we also know that implementing any kind of suicide prevention strategy, it's not just about the training and or the curriculum that happens within our schools. It's also what other interventions are available for our students. And so we definitely have provided a significant amount of support and guidance to our GSAs, as that is a suicide prevention strategy, along with the race-based student support groups that are across the district. That's also another suicide prevention strategy. And along with our GSA Summit, that, as you all know, has provided a space for many students that identifies LGBTQ and as an ally to come and learn. And so that's also suicide prevention strategy. This year we really tried to make sure that we were implementing the racial equity social justice lens, and we worked really hard to work along with Shanice's team, the community engagement department, to assure that we were putting the intersectional perspective in everything that we're doing, so that we're leading with race, with the concept that when we support our Black trans students, everything else follows after that. We've done a lot, and there's also a lot to implement as well.
Is that a
Any
helpful
questions?
scaffolding? Yeah.
Yeah. Any questions from board members?
So, but I'm getting it.
We're losing you.
Can you guys hear me now?
Something's happening. Something bad is happening.
We're getting a lot of feedback.
I'll try and call in on a different line.
Okay. So while we're waiting, for the general training for, I think mostly school-based staff, but I imagine we should also train up bus drivers and anybody who has real direct contact with kids.
Rita,
So what? Yeah.
I was going to say volunteers too.
Okay.
My experience as a volunteer who did some art education with students was we did self-portraits where students had a photograph of themselves and then they drew in the other half. And based on what the student when I saw it, I took it to the teacher, who then took it to the counselor. But just to have those parents who are in the school have some sense of things that they may need to pass on to another adult in the building.
I had a question.
Well, hang on. Before we move on to your question, can we finish with this one first?
Sure.
So my understanding is that we don't yet have the training for the kind of general adult population in schools. Do you have an idea when we will?
We have training that we can do. We need access.
Do you want to define what you mean by access?
Getting in front of thousands of teachers. So when we've approached folks from different groups, they've absolutely been on board. Whitney right away said, I would love for you and Mila to get in front of nutrition services folks, staff. Lamb said the same thing about campus security. We've worked with school secretaries in the past. So teachers is really our biggest group. So any support around that would be really appreciated.
Because I'm thinking this isn't really amenable to an online training. You really need to be kind of face-to-face, able to ask questions, go through scenarios. So that's more difficult. So are plans being developed for that kind of thing?
Rita,
Go ahead.
no, I just wanted to ask a clarifying question. Our plans, as far as like, are Amy and I trying to implement a plan to provide training for the adults that you're mentioning? And what do we currently have in place? Is that what you're asking?
Well, it sounds like you don't currently have something in place. So are you sort of, where are you in the planning process? Are you planning to plan? Are you actually working on a plan that you might at some point be able to implement? Kind of where are you?
So in terms of the content, we've both been trained. We could put together content and get in front of folks and do an hour-long training with very little difficulty. We've both had that training, both in Safe Talk, Question, Persuade, Refer. So evidence-based 1 hour long mental health suicide prevention trainings. So it really is having that opportunity to get in front of the larger group. It's not so much building the training, because we're doing that based on research that's already been done. It's again going back to the access, and James and Brenda, I don't know if you want to speak to that.
This is Brenda Martinick, Chief of Student Support Services. Thank you, Amy and Mila and James, for doing the Addie's Act policy. I did want to step in just a little bit and talk about professional development. Our PD team under the instructional core has been working on a lot of different types of professional development. Instructional core is our main focus, wrapped around MTSS, and MTSS is those systems and structures. Within MTSS is that social emotional learning, the proactive and reactive components. Within social emotional learning includes tiered supports. And so at that tier 3 supports, we're really talking about mental health, substance use disorders, anxiety, trauma-informed practices, and a myriad of things that we really focus on helping support our students to provide resources and supports and get them some services that they need. So in regards to the professional development, this is definitely an area that we've talked about. And as we're building our MTSS plan, we're moving SEL into the MTSS department this coming year. It's definitely something that we will be rolling into a plan for how we support our teachers who are working with our students. It's a key component of how we also provide those trauma-informed practices. So it's within a bigger frame. So the mental health components of what we need to provide education and support for with our teachers is incorporated into that package of social emotional learning. So while we have not specifically developed how we are getting in front of teachers in regards to mental health, we are working with our professional development department within our instructional core teams to see how we're going to carve out space and time to be in front of our teachers next year. And then pieces of that will certainly involve Addie's Act, the mental health pieces. We're also hoping that it will include some restorative justice practices, trauma-informed support. We're also going to have to wrap in professional development for trauma-informed approaches with our student that really center on our racial equity and social justice lens and framework. And so those are all of the pieces that we're working on right now. So we're not really talking about any one specific one. So hopefully that kind of helps frame it a little bit.
And can I provide like just an additional example, Rita, to your question? We collaborate with a local nonprofit called SMIRC, and they implement a training called Bridge 13 within our school or any school who asks for this particular type of training. And it specifically focuses on, it addresses the root causes of discrimination impacting our LGBTQ community to create safer spaces for queer and trans people of all ages. So Addie's Act specifically, the LGBTQ student population is one at-risk population to focus on. Now, if every school would say, we will provide a Bridge 13 training at the beginning of the fall term, and every teacher needs to be there. That is another way to provide a suicide prevention strategy. However, although Bridge 13 is a free training to PPS, they still have not been able to get into every school due to not offering PD time or not having the capacity to have all students, teachers there to be able to participate in this training. At times it has to be if a teacher would like to be part of this training, or at times admin has to make a decision to pay extra money so the teachers can stay an extended amount of time for this training to be provided, even though it can potentially be considered a suicide intervention training.
Okay, thank you.
This is Ailey. I have a question for Brenda. It's Ailey. I have a question for Brenda. Brenda, could you elaborate on the partnerships and the work you've done with Shanice and how, I think that intersectionality that you all mentioned, I'm really interested in how you're helping, especially white teachers, kind of do some of the unpacking around the cultural competency and the Res-J lens.
Thank you, Ailey. That is ever evolving because it's an iterative process. So what we have been doing is really focusing a lot on our restorative justice work and how we provide those tiered supports. I think we went over that a lot at the board meeting last Tuesday night. So that's really how we are getting into the schools and working on that. I know Danny and Chandra and Shar and maybe Shanice today also had a meeting of how we're going to then move restorative justice practices into more of the student engagement opportunities and how we have student voice. So those things are continuing to evolve. I know Mila has also been working on that, so Mila might be able to answer a couple more questions about that.
Thanks for that, Brenda. I think that, especially with the way we set out our budget and our definite longing to be really, really focused on our Black and Native students' experience, I think that this work, especially with suicide prevention and the things, Mila, that you said about, students of color and their responses to those surveys and the way we can do some suicide prevention and how key and crucial it is for those to be culturally responsive and for teachers to have that depth to their training as well. And I really want us to make sure we're partnering as we do these things with Shanice and Danny and their expertise there, because I think we have this wonderful opportunity right now to really be clear about our school system and those places where we really need to be better than we have been in the past. And so I know, Mila, you mentioned that you guys had collaborated with Shanice, so I just wanted to hear more about what that was, because it makes me excited when PPS stops being siloed and departments actually work together and people collaborate, because I think we have a lot of brilliant leadership at the table, and I want to make sure that we're cross-pollinating because I think that's what's in the very, very best interest of our students.
I appreciate
Parker,
you asking, I appreciate you
Mila.
asking that particular question. And you're absolutely on point and very, very important matter to why Addie's Act even exists, right? And so definitely, Shanice and Danny can both attest how much I land in their emails and ask them 100,000,001 questions. And they can also probably speak to the fact that I'm one of interested in collaborating all day, every day. And so this work cannot be done in isolation. This work is definitely, when we're thinking about suicide prevention, intervention, and postvention, it is pollinating in every work that we do. And honestly, in every individual that is walking into that school building. And so, and as of last week, actually, Amy and I were meeting with one of Shanice's colleagues so that we could speak to the board advisory to get their feedback in regards to this particular policy, making sure that if they have anything or some feedback that they have in regards to it, that we would love to get that from them. And so we were working with her on that specifically last week, and we will continue to collaborate and implement those efforts, because I too agree that nothing can be done in isolation, specifically when it comes to our most at-risk students.
And speaking of students, I totally did a horrible thing, which was Parker had a question, and then I interrupted and asked my question before Parker could ask his. So I would yield the floor to Mr. Myris.
Mr. Myris. Wow. All right. Thank you. I was wondering if it details in the policy specific steps that are to be taken based on the situation. So if there's something that would flag a teacher in an essay, what are sort of the steps that would be taken to ensure that concern is dealt with?
Can I field this one?
Sure.
Sure.
I advised Amy and Mila not to go into the specifics with the policy and to reserve that for the administrative director to really lay out how procedurally this will work. They provided you some documentation about kind of the guidance that they're going to be following for that, but what I had asked them to do was to keep it more high level for the policy. So while you'll see that there is a plan, it just speaks of it in more general terms.
Okay.
So that's on me.
All right. Sure. And then I had one more question, which was, is there any sort of resources or staff that that's accessible to students? Because I think if someone's friend is showing some of the signs attributed to suicidal tendencies, it's going to be a friend that notices before a teacher or another staff member. Are there resources allocated for that?
Absolutely. So that's a great question. Do you prefer Parker or Mr. Myris?
Parker.
It's a great question. We know that peers are often the ones who are actually gathering that information and supporting each other. And we've got a couple schools that are doing great work around that peer training, Lincoln High School being a model for that. So absolutely, there's definitely curricula out there that will support that work. Additionally, there's something called Youth Mental Health First Aid, which has historically been for adults working with youth. And now there's been a push for youth to get trained in youth mental health first aid to be able to support their peers. So we're looking into piloting that as well. But that is absolutely, we don't mean to focus on the adults because you're right. This is about the peers having the information and being able to support their fellow students. So it's a both and. Yeah.
Amy, can you talk about the youth mental health app too?
And I would jump in right here. This is perfect, Parker, to say this also, like, how do we do this in culturally responsive ways? Because I think white peers interacting with other white students, that will be different than Black students interacting with other Black students, or again, cross-culturally. And so how we're training students to see and respond really needs to be deeply informed by that racial equity work as well.
Absolutely. Yes, Brenda, we have a youth resource app that has been in the works for about a year. Who knew? Who knew that turning a small piece of paper with lots of phone numbers and resources on it would become such a giant undertaking that involves things like privacy policies and all that. So we are about an inch from the finish line here. Mila has also done a ton of work on that. And we are in the final stages of creating a plan with IT to be able to support the app once it gets launched over the next couple of weeks. So that is absolutely another suicide prevention piece that we will have in place to support students.
And I would also say that there has been some individual types of training / workshops that Amy and I have done throughout the year that could potentially be done even more if more schools were offering this. But I do, Parker, you bring up a very important matter that students sometimes don't know what to do when a young person says, I want to die. And so it is important to be focusing on that aspect of the work in the intervention or prevention strategies that we've done. So last year, or whenever that was, at Lincoln, Amy, a student did a mental health awareness day, or what was it exactly that she called it?
Yep.
Yep. And so she was able to collaborate with other staff to basically create a whole day that focused on mental health and wellness. And so different workshops throughout the day were implemented, such as art therapy. And one particular workshop that we provided in particular was to address your exact question, Parker. What is it that we're doing about suicide prevention? And talking to the students there, whoever did show up, in regards to what is available to you, what can you say, what should you say, and what supports are going to be provided after the fact. So there was a lot of great questions that they had asked of, like, well, what if they get mad at me, or what is it out there for somebody who isn't Spanish speaking, or what if they identify as LGBTQ and they're feeling suicidal? What do we do then? And so that was definitely a huge suicide prevention strategy that we would hope would be available to everyone. That's just one school that was done. However, super important to be known that young people do talk to one another and or see something, they should say something, right? But also know exactly what it is that they should say that supports the young person through that experience that they're going through.
Yeah, absolutely. I'd like to mention, if you have these sort of trial programs, run it by the district student council. It's kind of what we're there for. But just another resource to kind of pressure test it through students. But I did remember the app.
Yes. We talked about that in the back of
Yeah.
one of the board meetings. Yeah.
Yeah, glad to see it's finally getting out there.
Yep, appreciated your feedback. And we absolutely, in fact, I think we have some time coming up, don't we, scheduled with them, Mila, to present a couple different things. So very much appreciate that.
Fantastic. All right, thank you.
This is Julia. Can you guys hear me?
Julia? Yep.
Yeah, so sorry about that with my audio earlier.
I'm making weird noises because it was like it was the last time you spoke, Julia, just to give you a bad time.
I was gonna say that sounds like my dog is dying. So I had a couple of just overarching questions about the policy, and I want to thank staff for preparing it. I was at an event last year, the year before, where Addie's family was there, and it was a really compelling story and heart-wrenching, and especially knowing that PPS, there was a connection to the PPS. So thanks to the staff for putting this together. Just in terms of the policy, it's fairly, it's like a framework versus the substantive. And so I understand, it sounds like some of the information is going to go into the AD, but so I have just a couple of questions. So the first click down is this ours, or is this the OSBA recommended policy that they suggest we pass?
We PPS'd it. They gave us their version and we didn't love it, so we adapted it.
So it still seems, so I'm thinking about how, like, we make this most accessible. Because we talk in here about the plan is going to be accessible, or the policy must be available. The plan must be available to PPS community. So if we have, and this is a little bit similar to my concerns earlier about the meals expense policy, but if you have a policy that's fairly generic, then you have an AD, and then you have a plan, and actually get the policy is like 4 clicks in. I'm concerned, or you're requiring people, like, you went to the policy, now you have to go look at the AD. If the AD is not clearly linked, or people don't even know what an AD is, how do we, this is a bigger policy, like a policy making question, but like, how do we have information like this accessible, that you're not having people having to go a number of different places before they just give up?
We can hyperlink the plan once it's completely developed and put it at the end, and as we have done in other policies.
So that
either that or, I'm sorry, go ahead.
I was gonna say that would be great. And then the aid, I look at this and it's like, there's nothing here that I would like, okay, it's not, there's nothing here objectionable, because it's just like facts. But then again, I would say is like, is this really the useful piece of information, or is it something else? So
We,
I guess when somebody is like suicidal, or they've had somebody in their family is like, how are we going to make this super easy in plain English? And like, as me as a policymaker, again, like I could pass this tomorrow because there's nothing in here that's like factually inaccurate or like not value based, but it's also like not the plan or the AD.
we could not agree with you more. We feel the exact same way, which is one of the reasons why we changed some of the language on it originally, because it was totally inaccessible, in my opinion, our opinion. So any advice this group can give to make sure it's accessible to students and families, we are completely open to it, because we want this to be useful. We don't want it to be just a bunch of words.
And we are totally committed to that. I mean, I think that that's why if you look at one of the documents that we added in the folder for you all to review was something called the Portland Public Schools Suicide Intervention Prevention Postvention Resource Guide for School Personnel. That's where it is a step-by-step. It is very in-depth and super long. And so we can't, what we were trying to do is have the framework be one thing and then have this guide be something that could be individualized and implemented by a staff who is going to need what intervention strategies are available, what postvention strategies and or resources are going to be available to them. But yes, any feedback would be super great. And we did try to change it as much as we could while also keeping it simple and direct. And this is here for a reason, and it matters. And so it's important to make sure to implement something that's going to be useful and friendly, family and youth friendly to people that are going to be reviewing it and seeing it.
Yeah, I guess my feedback, and this isn't about this specific issue. This is it's Roseanne and Liz and the committee members will know it's a sort of a broader issue, is that, how do we click in? So if we have a guidebook, is that what you called it? And a plan and an AD, like, are they different pieces of information? Are we asking people to wade through it? Like, if you're going to have a pretty simple policy, that's fine, but it seems like then everything else should be in one place, because I think, I'm thinking about just a classroom teacher, like, hey, I've got a lot of other things I'm supposed to be doing, but I'm concerned. So where would I go and where would I find the information? And I guess then my other piece, just as a board member being asked to approve a policy that's just really high level, that it would be useful to see all the pieces. So the question that was asked earlier, and it's like, oh, that's in the AD. It's like, well, we don't have the AD, so it's a good question about where that is. And so this is more about just how we structure it and then making it accessible. Because I don't know if it would comply with state law that it be easily accessible if you have to do three clicks in. And then just the one substantive piece, and this isn't in the policy, but more, I'm just thinking from a sort of real life experience. So it seems like in the information we have here, it gives a framework, and then the plan, it talks about the the identification, what you do, and then like when the school comes back, but it doesn't really, I'm not sure who's accountable for doing all this. Is it a school counselor? Because it says school staff, and I think what could happen is everybody's, well, that's the other person's job. Like, or we don't have a school psychologist, so it's this person's job. Or like, hey, they run, the way they do their counseling is they do have a college counselor and then these other ones. And so I guess having more specificity, like whose job is it? And who's the point of contact? Otherwise, I have a feeling we'll get that was somebody else's job. Like when the student walked in the class, I welcomed them back, but who's looking at the bigger plan? And I do know just from having kids in PPS that I think PPS does a good job on the front end. I think could be a case be made for better coordination on the back end? Is the student getting, help with what the underlying issue was that precipitated suicidal ideation or an attempt? And then just making sure that that's like somebody's got it, not I thought somebody else was doing it.
Yeah, we appreciate that feedback. I think currently, most schools would respond that it's the counselor, psych, social worker, that group. All three of those people have been trained in doing the screening. So that's generally the person that the teacher goes to. And that needs to be named. And sometimes the teacher sends an email at 5 o'clock at night that the counselor doesn't see until the next morning. And so we need to train on that if you're concerned about a student's suicidality, you need to be picking up the phone and calling one of these three people in your school building. So we do have some of that scaffolding and foundation currently in place, but absolutely it needs to be named. And as we look at the tiered supports, who's kind of landing where in terms of supports for students, following up, that kind of thing. So we feel like we've got some really good work in place that we just need to continue to build off of and make better.
And Julia, to your point, in looking at the training piece, the reason we made some last minute changes is under 1A, the expectation is that all school staff, Amy and Mila, correct me if I'm wrong, will be trained on the risk factors and warning signs. So we want everyone on notice, to be able to look for, be cognizant of, and look for, and know who to report to. And then under B is the training, the specific staff you're talking about, the counselors and school psychologists who are trained in sort of have more expertise in this area in mental health and
I do want to, sorry, Mary. This is Brenda. I do want to acknowledge that we also increased our counselors and our social workers QMHPs for next year. So we have added to our skilled expertise, and we are working on how we're aligning providing PD and ongoing services. The other thing we've done with our SIA dollars is we have added additional resources and supports to help students who are transitioning back from treatment facilities to do a soft landing, either in our Bright classroom that will be opening up at Roosevelt, or how we offer some of that soft start transition into our schools, so that they're just not enrolling and there's no transition plan, there's no support plan in place, and they're left to fail. So we have increased through our SIA dollars support there too. So I did want to let you guys know that we're building our program, we're building our mental health supports. Within the last 3 years, we have gone from supporting mental health with about, I don't know, $50,000, Amy, how much?
It was nothing. There was nothing.
Yeah.
No, it was all our community partners billing insurance. Yeah.
Yeah. To now, what we do is we make sure that we are providing mental health supports no matter who walks through the door and regardless of insurability. That has been a huge priority for me and for my team, is that we are making sure that we meet every single student where they're at, that we will figure out the financial need, and we will either cover it through our contracts or help agencies build. We're also working on a more culturally specific mental health and counselor support. And so Amy and Mila have been doing an amazing job with that. But within the last 3 years, it has over tripled in the support that we have been able to fund for mental health, for substance use, and for our social workers in order to make sure that we are providing that need. So that is good news, and that is to thank you to the board for helping prioritize that. that has been a huge need and something that we have been able to start supporting more systematically. So.
Absolutely.
I just wanted to one other thing. This is James Loveland speaking. In anticipation of those added SIE positions, we've also done some work this spring to really map out the collaboration between our support staff in buildings, social workers, counselors, and school psychologists, to address the very concern that Director Brim Edwards was referring to, which is whose job is it, who's doing what, especially when buildings are facing a variance in their staffing. And so we've created some guidance that our hope is that we will build building administrators' understanding of what each role brings to the building, what they're capable of, and define with some clarity how each need and delivery of student support can be executed between that collaborative of psychologist, counselor worker, social worker, and counselor. And so that is coming soon. We're working with PAT on fleshing that out as we speak.
I will also like to say, no, go ahead.
Sorry. So can I follow up on that? So you just mentioned that you're talking to PAT about this. Have you run the draft language of the policy past PAT and PAPSA counselors? Who's been consulted on this? Have you brought in any students to talk about this? What kind of outreach has happened around the drafting of this policy thus far?
Do you want to go? You want me to go?
Sorry, I keep like unmuting and muting. I know that this is something that Amy and I have worked really hard in collaborating with with the state alliance that has been supporting all of the school districts across the state of Oregon in regards to implementing Senate Bill 52. So we've been working with that particular agency who is connected to the Oregon Health Authority. We've also been collaborating with other school districts that have been working on implementing this as well. And I know that we have received and have tried to gather feedback from some of the school social workers as well. And we're working on getting the student feedback because we know that that's super important. Who am I missing, Amy? But I know that we've definitely tried to gather feedback in regards to staff as well, in regards to what we put together. Am I missing somebody?
So how have you been getting student feedback? Have you been working through the student engagement person? Have you worked through the engagement office?
We have been working with Yan Seichow from Community Engagement Department so that she can connect us with the student advisory. And so we've been talking to her the past couple weeks. And so we're actually going to be meeting with her next week again, or with the advisory. It's coming up, but for that student feedback that we have not received yet.
And so the framework is in obviously connection to legislation that we don't have a lot of wiggle room around. And so we're really, as we move into this, we continue to build off this work. That's how, as we look at building off it, we're going to families, we're going to students, we're going to additional staff. We've already done cross-departmental work around it. We've talked with community agents. So we've talked to lots of different folks. But I think this initial, the policy, there are certain things we just have to have in it no matter what anybody thinks, right? And then as we build out the ADs and we look at what does this actually look like in real time, how do we make sure this is responsive to what students and families are identifying their needs are, that's where we're really going to be leaning on them for their feedback moving forward.
So, I guess I had another question about this policy. Okay, I have to admit, I did not go back and read the legislation. I looked at it quite some time ago, and I didn't go back and look. Does the legislation require a separate policy on student suicide prevention?
That's the legislation is the policy. Mhm.
But I mean, it has to be a separate policy,
Mhm.
because it seems to me that this is, yes, it does. 'Cause
Yes.
it seems to me, this has to be embedded in a much bigger infrastructure around mental health and behavioral health. Okay, and I gather that most of the specific language in here is mandated by the statute as well. Is that correct?
Yes.
Okay. I still think it would probably be a good idea to, before we get much further into kind of wordsmithing, I think it would be a good idea to bring in Shanice and Danny and the whole engagement process in order to make sure that kind of upfront we have some policy language that the people who are going to be experiencing it either as professionals or as students have an opportunity to weigh in on the language. And also, if we're going to be using external partners to do any of this work, and I suspect we are, it would probably be a good idea to get their input as well. And as happy as I am with the current state of mental health and behavioral health services in PPS, I know an enormous amount of work has gone in over the last 2-3 years. There's no guarantee that we're going to have the funding to keep that up in coming years. So we need to make sure that that the policy language will be doable, regardless of the delivery model that we are going to be using. So anyway, I think I think it would be helpful to get more eyes on the draft sooner rather than later, before we get too much further into it.
We
Does that make sense?
we love collaborating, so we are fully on board with that idea, and we will absolutely, yes, absolutely. And in terms of your funding question, I think for you to know, as one social worker to another, that we are constantly in a state of not believing that anything is going to last forever. And so we've got relationships with community-based agencies, insurance companies, Care Oregon. We're meeting with Care Oregon to talk about what does sustainability look like when we don't have any money, but we're relying on insurance. So that's always part of the way that we think about things as well.
Yeah.
I echo what Rita was said there. This is Ailey. Addie was a member of my community, went to the high school my daughter goes to, and I know people who are close to their family. And I think what I'm hearing from Parker and from Director Brim-Edwards and Director Morris, the sense that like this is so important, like we owe it to Addie, we owe it to the spirit of this law to really make sure, like Julia said, I loved what you said, Julia, about like that someone actually knows it's their job, and maybe everyone thinks it's their job. And so I echo what Director Moore said. I really think we need deep engagement with our community partners on this and student voice, and especially, I mean, I think I used to be on the board of NARAL Pro-Choice Oregon, and I learned a ton about community engagement from them, and especially around cultural relevancy, because the ways that people were having really difficult conversations about reproductive rights and healthcare was so different culturally. And what I, as a white person, think is the appropriate response. I just think having those eyes on the draft and how we think about this, and I know a lot of that is in the AD, but I think as we set the policy, again, we have a chance to really be on the forefront of this. And like you said, you took OSBA and you PPS'd it up. And I think we can even PPS it more. Sorry. So Rita, sorry, you were still talking and I just jump in and interrupt because it's Zoom and I can.
Because I think especially with mental health, we know there are very significant differences across cultures in kind of how mental health is conceptualized and how, you know, how healthcare is imagined in around mental health. So I think it's especially important that that we make sure that the Res J lens is applied to this policy language as well. So I guess my last question, there may be others, but I think my last question is, does the statute have a deadline by which every district has to have a policy in place?
July 1st.
So this has, by statute, we have to have this, okay, well, even if
That's
we
what
passed it today,
that's what it
that would
says.
not be possible.
Yeah, and I don't know any districts that will be able to do that because the rules just came out a couple weeks ago. So this is, yeah,
Okay.
folks, we've been working on it for all year, but the rules just came out a couple weeks ago. So I'm not sure any
Okay.
district will be able to meet that deadline.
Okay. Well, that's good information to have. It's good to know. It is impossible to meet a July 1 deadline for this policy. It just is. Even if the committee passed it today and the board did a first reading tomorrow, it would be another 3 weeks before we could even have a vote. And I don't think the committee is ready to pass this on to the full board. So can somebody look into what the implications are if we fail to meet that statutory deadline? Can somebody, Mary?
Okay.
Somebody?
It's an attorney's job or, yeah.
Absolutely.
Yeah.
I think, and not
If
being,
I may,
yeah.
So SB 52 does have, has an operative date of July 1, but it also then just below that in section 2 says that, I mean, there's a little bit of wiggle room. It says that it is necessary for the school district to adopt a policy on student suicide prevention by the beginning of the 2021 school year. So although that's a July 1 operative date, we have some time. We just have to get it in place before the beginning of the school year. Of the 2020.
Okay,
So by,
Okay, it does, but it does mean that if, I mean, people are going to be going away, right? Even if they're not leaving town, they're checking out. I think it's going to be important to really loop in Shanice and Danny and PAPSA leadership and, you know, all the other stakeholders in this to see what we can do at this point in order to have, I mean, we're probably going to have to do it quick and dirty, but I'd like it to be as thorough and comprehensive as possible so that we get the language right. But we've got, what, a month to do whatever engagement we're going to do on this policy. So I think we need to really fast track this as much as possible. Shanice, Danny, do you have any thoughts on this?
Hi, folks. This is Shanice. Yeah, I think I am resonating with the conversations, especially as I reflect on these realities that we have, the work that's been happening across the district before the Addies Act, and what it really means to build upon those structures and support them is critical. I think just due to the nature of this work, we're talking about someone who is a part of our district, but it's also Pride Month, and as a queer Black woman, just naming you know what it really feels like to engage in this kind of work at this phase, and now I'm getting fully caught up on where it's at and all of the moving pieces. So I think I would offer to this committee and my colleagues opportunity to just create an engagement process that also thinks about all of the different stakeholders, unions and students. And I think our bond and budget engagement in particular has been trying to figure out what it looks like to create and center a process around the stakeholders and where we want to hear from. And so I think modeling this here, in addition to the student council, might look like connecting with queer folks, students of color, uh, in maybe more than one phase of the work. And so I'm hearing the AD is the technical how-to part of it. But as we experience with our search and seizure policy and the matrix in which we unpacked each of the components that are priorities to students and where they might fit and where they don't, I think that work might be even more critical now, and just being mindful too of the context of what we're sitting in. And it's very hard. It'll be very hard for students to talk about this as they're trying to deal with their own stuff, in addition to each other, right? As we might share and occupy the identities called out here. And so those are my reactions. I think there's some space for us to maybe think about the steps that have taken place and maybe weave in maybe an engagement timeline or engagement plan that calls out our stakeholder groups, in all of which the policy committee has named, I think, are core ones. And I'm making sure our queer folks, and I know GSAs are a critical part of the work happening in your area, and just what it looks like to engage queer student leaders during the summer. That might look maybe different than it might look during the year. And so those are some takes I think that I have and would offer. I know there's some connections with students and some other touch points along the way, but for us to collectively have that space to vision this process.
So if I can make a suggestion, I doubt that we're going to be able to pull together, you know, the kind of comprehensive engagement that we would want to do ideally. But if we have to have something in place by the start of the school year, maybe if we could, I think you mentioned, you know, do it in phases. So come up with some preliminary language, get it on the books, and then we can kind of resume some engagement after school starts. And the language can always come back to the committee if it turns out we need to revise the language in any way. But I think we have a drop deadline of mid-August to get it on the books, which means, given that we've got a 3-week period, you're looking at, you've got like 3 weeks to pull something together. So anyway, does that sound doable for everyone?
I mean, just to go back on the 3 weeks, I guess one of the ways to look at it is if we also have the whole like 21 days that we can, you know, I think would almost pull us into the start of the school year. I hate to, like, I guess if the lawyers can answer this, you know, if we're 3 weeks late or 5 weeks late, does it make a big difference? I just think it would be great, to Shanice's point, to take Shanice up on her offer to engage students. And I think just our policy will look more than, I don't think I'll look at our policy and say, is this an OSBA draft? If it has like student engagement and sort of students are informing the policy. So I guess the question is, if we're 3 or 6 weeks late, does it matter substantially, as long as we have a draft and a plan?
I don't know the answer to that right now. I can find out.
I can speak from our department's perspective. I just want to say a couple things. I want to make it clear that my team has done an incredible amount of work with what they had, with the information that they had that's come to them. And so, we were more than happy, as Amy articulated, to do whatever work needs to happen around engagement and collaboration with Shanice and Danny. I think we would rather take our time and get it right. And so I agree if it's kind of negligible, the difference between a couple of weeks late and several weeks late. I think we would rather dedicate time. We will do our best this summer to get the work done in a timely fashion.
Great. And this is, James, this wasn't a criticism at all with the work that had been done. I also think having the engagement starts to give students ownership in the policy, and it raises awareness. And if it makes, and because of their input, makes it more accessible, I think it just builds on all the professionals' work that's happened in the district to date. So I view it just as an additive to good work that you all have already done, not as a replacement in any way. But hopefully it makes it even more accessible to our students, which I think ultimately that's the goal.
And I appreciate that, and we're fully committed to that student and honestly family feedback as well. I mean, this has impacted a family and the students as well. And so I know that Amy and I have talked about this actually at extent, knowing that the topic is so sensitive that we wanted to be very mindful that we were moving slow to move fast. And so we did consult with other counties as far as how have others gotten feedback from families and students in a culturally responsive, trauma-informed way. And I will say that we're going to be the first ones to do this. And so they were like, we want to do that, and we haven't done it yet, and we don't have any ideas so far. But they gave us other things to work with, which was great. We were going to go to something called the Children's Advisory Systems Council that is led by Oregon Health Authority, that does have families and youth in that whole statewide advisory. And then we were given feedback that maybe that topic along with that particular group wasn't going to be the best of ideas. And so that's why we wanted to make sure that Amy and I were not just going to move forward with all these ideas that we had, because we really truly care for that feedback. And so that's why we went back to make sure that with Ian, with the community engagement department, making sure that we collaborated and consulted with her as far as, okay, what engagement strategy do you think will be best? And her suggestion was to start with the advisory first. And then Amy and I have talked about creating a task force that involves families and youth and other stakeholders to get that feedback as well for the year. So not just for that time, but for the year that we are implementing this process. And so we're trying not to move fast, and we don't totally agree, and hoping that we can continue moving forward in our collaboration with Yan and the advisory, so that we can get that feedback along with creating that task force that we really do want to create.
So another place, thank you, by the way, for all of your work to the team. Another place that it seems like we should tap into, in addition to the District Student Council, of youth who are really fluent in the topic, are the volunteers at Lines for Life on the Teen Talk line. I mean, it's pretty amazing. I had a chance to visit their call center. That kind of sounds like the wrong place, but the students who are there are just like super aware, and they've got great insights and empathy, and I mean, they've been sort of a little bit on the front lines. So if we could tap them, seems like another great place.
Yeah, when Mila mentioned the Oregon statewide Alliance to Prevent Suicide that we're a part of and meet with monthly, or it sometimes feels like more frequently, students from that group are on that advisory. So we've been able to get some of their feedback throughout this process as well. And again, I think to reiterate that many topics are sensitive. This topic is extraordinarily sensitive. And the last thing we've wanted to do, so this is actually really helpful for us to go through this process with you all, was to throw a bunch of parents in a room together who have lost a child by suicide or who've had a child who's had an attempt, super not trauma informed. And so we've had conversations, one-off conversations in some different formats with some different parents who have lost a child to suicide, who have given some feedback. So I think, again, continuing to build on that through this community engagement process makes a lot of sense. I think the other piece, attorneys on the call, if it's helpful in thinking about 4 weeks, 5 weeks late, we have a suicide screening process in place that our staff are trained in and will continue to use. And so that is in terms of safety, risk, or concern, which is, you know, a big piece of this policy to make sure that students are identified and screened and supported. We already have that in place. So that should not be a concern when looking at this if it gets passed on October 1st and not September 1st.
And I will have an answer for you, and I'll relay the information to everyone involved, everyone on this call today, to let you know what I find out. Sorry, I don't know ahead of time.
Thank you.
That's okay. Okay, so so why don't we stop here? And we may end up having to have like a plan A and a plan B. If it turns out that the start of school is a drop deadline, then we may just have to do whatever we can do in addition to what's already been accomplished in terms of reaching out over the next just few weeks, and then get something on the books and then kind of return to it once school starts. So I guess the only other thing I wanted to say, in my day job, I know that I've been in meetings where the work that you guys are doing around mental health and in particular about the suicide risk has been a topic of conversation among representatives from other districts. And I will say that they look to PPS as kind of the leader in this. So it always makes me very proud to hear them talk about all the strides that you guys have made. So if you can all kind of get together as staff and sort of figure out what the next steps are, I think that would be helpful. And then once you figure out what the game plan is, can you just let us know? And then we will, then the committee will schedule follow-up meetings accordingly. How's that? Does that make sense?
Sounds good. And when you say let us know, say more about that? Let you know, send you an email, Roseanne?
But yeah, send me and Roseanne an email and I'll pass the info along. Because there's a few decision points. You've got to get some more information, like, do we have a drop deadline or do we have some flexibility in terms of when this thing has to be on the books? If we do, then, you can do things differently. If we do have flexibility. If we don't have flexibility, then we're just going to have to crank something out. And then come back and look at it again.
We'll wait for Mary's response. If I were a Benton woman, I'd say we have flexibility because the Alliance frequently speaks to the fact that no one will be able to hold the 90-something districts accountable for their policies. So I would guess we'll have flexibility, but I will look forward to Mary, the information you find.
Okay. Thank you so much for all this. It's great to see how much work has been done. So thank you.
Thanks for your time.
Okay.
Yep.
Okay. Thank you.
Thank you.
Okay, so we're a little bit over. So I want to move on to the two policies that are in the public comment period. The first is workplace harassment. Have we received any comments?
We have not received any comments.
Okay, And if I remember correctly, this is on the agenda for next Tuesday for a second reading, correct?
For tomorrow, yes.
Right, tomorrow. Yes, that would be tomorrow.
So I had
Okay.
a question about that. So I noticed this on
Okay.
the business agenda, and just as a general rule, I don't know that people are ever going to know. I mean, as it is, we're in this COVID era. There's very little transparency, and I know having something as a 5-minute note at a board meeting is not that much, but I think it's going to be impossible for people ever to know what policies we're changing when we have something on the business agenda. I mean, I can always pull it out and say like some comment about it, but I just think as a practical matter, unless it's really a nothing policy, it seems like we shouldn't do that in the business agenda. I mean, I think there's a reason we're not getting any comments about anything because there's like one very brief moment at the board meeting, and then, unless you go to the website and look for it.
Well, there's another possible explanation, and that is that this is a pretty technical fix, and it's not going to be the top of most people's minds. So, I mean, yes, it could be lack of publicity about the project, the policy. It could also be lack of concern, lack of interest, lack of.
So is this just as a reminder, this is a question maybe for Liz, this is linked to the bill that passed last session for employers, correct? Yeah, so, I mean, for what it's worth, it was a huge topic of discussion in the legislature for quite a long time and very contentious. So again, we can do it however. I just think it's better practice to like, hey, we've done our work in this area. We've conformed our policy to the law. Here's the highlights. I was going to raise it tomorrow anyway, because I noticed when I went through the agenda, but again, we don't have to spend a lot of time discussing it, but it was huge discussion in the legislature and among employers.
Well, there are many things that are huge issues in the legislature that most people don't follow assiduously. So that doesn't surprise me. Anyway, okay, if you're going to bring it up tomorrow, bring it up and we'll talk about it. As I recall, we have a pretty full agenda tomorrow, so I don't think it warrants an enormous amount of time.
Well, I don't think it does either. I just don't think it should be buried on the business agenda.
Okay, fine. Okay, the next is search and seizure. Have we received any comments on that?
We have not received any comments.
When does the 21-day clock run out on that one? We're
July
approaching it, aren't we?
Well, we have it scheduled for July 14th, first reading. So it's
July 14th, okay. Yeah. That would be second reading, right?
Sorry, second reading, yes.
Okay. All right,
Chair,
next is,
I'd like to make a comment on the search and seizure, if possible, in terms of where we last touched base. I know there was an expectation to work with our ResJ partners on just the current state of the work and reflecting on some of the engagement that they do, especially with both Danny and the superintendent. They have a convening that takes place regularly, but the reality is that we're currently in our request for proposal process, or RFP. And so that has maybe complicated the ways in which we engage with them. So I just wanted to name that the timeline in terms of when we can have an intimate conversation with some of these partners. I'm hoping to have some of them, but the full context is that we're engaged in a very interesting process that does limit us with how we react. But ultimately, there's a connection, right, with search and seizure and some of our other overarching shifts regarding safety.
Right.
And so, just
Right.
wanting to ask, I guess, the policy committee for an opportunity to reflect on those things as we are moving through this timeline.
So, so just to clarify, you guys already did a fair amount of outreach to them prior to this, correct?
I'll name, we definitely did engagement, significant amount of engagement with students and connected with some key groups. One of which being the Community Healing Initiative, and folks who were engaged at a local committee, PSEP. And there are some other groups that we also worked with, but those were not necessarily our ResJ partners. And so some of the thoughts were maybe we touch base with some of these folks specifically on this policy. But yes, to answer your question, there has been a substantial amount of journey along the way with how we've engaged students and partners.
So are you imagining that we would hold off with a final vote on the policy pending additional outreach to the ResJ partners?
I believe, to my understanding, there's an expectation to engage some of our partners as we bring this policy forward for a first and second reading, in the timeline in which I would hope that to occur might not align, and so we can absolutely figure something out that might make more sense, but to update you all on what that looks like in terms of our communication with partners during the period of time. And my initial assumption at our June 1st policy committee meeting did not, it wasn't capturing that context.
So here, this was my understanding. We postponed, we did a number of first readings on this policy, as I recall, with multiple rounds of engagement with various stakeholders, and finally got it to the first reading. And my understanding was that at that point, we had done whatever pre-policy outreach we were going to do, and then a 3-week comment period where anybody who was unhappy with it would be able to, or had any kind of feedback, would be able to offer it, and then we could take it into consideration. And absent any additional commentary, I think the common expectation was that we were going to have a second reading and a vote on July 14th, I guess. Is that right? July 14th? And the reason is that we need to have this policy. We've already, we've already gone through, this has been on the table for, I want to say something like 14 months, 15 months. And my understanding is that principals and staff and families really want, and students, don't want this to be hanging fire for yet another year. So I guess from where I sit, at least, I'd have to hear something really compelling to not go forward with that calendar.
And Shanice, I would agree with Director Moore that that's what I understood the timeline to be, and that if there were other comments from other partners, that those would need to be made in this 21-day window that we have between the first and second reading. Is there, I mean, what is your plan around engagement? Are there specific partners that we need to reach out to ask them to read this? Or I'm just curious, how do we do the work of making sure we've heard robustly from the community, but also, like Dr. Moore said, we need this because it is such a departure from what we have.
No, this is helpful. And, I simply just wanted to name that given my own potentially wrong assumption on what I needed to maybe support this work with between our last meeting and now. And so, yes, I agree. There's been a lot of work done to the policy, and there are definitely folks engaged in other conversations that are essentially connected that we can lift this up with. And so, just to reiterate that I'm more interested in being aligned with you all, and if that's where you are, and then we can definitely make the adjustments and just operating off of the assumption that we had some more work to do.
So I have a
If I could just
slightly
add
different.
one
I have
quick
a-
thing. Oh, sorry.
I was just going to say I have a slightly different point of view of. To me, like Rita, you said, is there like some compelling thing? It's like, yeah, the last month is a compelling thing, and I think that a policy that's titled search and seizure, I think it's important if there's anybody who feels like they didn't have a say, or any group that we feel like we need to go back to. We spent 16, whatever, however many months in a totally different environment. And I think things have changed, and, like, we don't have school resource officers anymore. So I'm not opposed. I don't even really like the title of it, because it implies like some sort of like police action. So I'm not in a big hurry to like run this through. If it's another month, I think we should take another month.
The only thing that I will say is that the current policy as it stands doesn't afford the same protection that the new policy does. So that's just something to think about. And so when, that's all I have to add.
So as long as we're done before the start of school, because in effect, we probably don't have very many instances in the summertime. I guess would this policy would be operational? It's a good point, but I also like, hey, we don't have kids in school. And I'm sorry, Danny, that we both jumped in at the same time. So my apologies.
No, that's okay. Point of privilege. I apologize. I guess I would just add one thing. So like as a disruptor, right? Like as a system, one of the things that we're really trying to take into balance. Thank you, Director Brim Edwards and Director Moore and Director Lowry. I think that we really have to kind of balance our sense of urgency to get something done with the slower, more difficult work of making sure that what we sort of prescribe is actually what is wanted and what sort of like come from folks. And I think over the last couple of weeks, and certainly the last year, as we've established, our work around engagement, I think one of the things that we've really tried to do is to sort of say that we want to make sure that we have fully vetted and sort of brought sort of community in a different way. And I think that we have mechanisms, and Shanice's team has done a really elegant job of sort of being able to bring people in
not just to kind of get feedback to something, but to also kind of like participate as like thought partners. And so, I think that there may be some unintended consequences of moving quickly on this, even though there is a ton of benefit that we can see as folks who are part of the institution. I think what I have experienced is that community is extremely wary of fixes without their sort of like involvement. And we do have like a deep bench of partners who've been engaged on student discipline and certainly issues of criminal justice reform that I think would be willing to do a quick review for sure. I think, but just given kind of where we are in transition in a lot of things, it would just be a matter of needing to kind of get the time to make sure that we're doing it thoughtfully with their timeline. So and I think it's difficult. I think you bring up really good points around needing to kind of move quickly to show our commitment. And I think that that's the tension of sort of like wanting to do it really well and with a sense of urgency. But I suspect that we may get further with more buy-in from partners that we're establishing are part of that can be part of our decision making, and certainly under your leadership as board members, I think that we've kind of turned this corner around asking folks who don't typically get asked and sort of like bringing them in. And so I just think that this is like you all said, this is a really important policy, and it has a potential for a large impact. And so I think that we can actually go further if we just slow down for just a moment and think of it as a temporary slow down, just acknowledging all that's going on.
And Danny, my response to that is to be a little frustrated because I feel like this policy is something we've been talking about since I got on the policy committee, and I know you guys had talked about it before I joined. And I felt like this was one of the policies where we said we need to do that deep community engagement work before we submit the policy to the community. Like it needs to be informed, the creation of it needs to be informed by the community. And I know that you and Maxine did a lot of work with this and talked to students, and we had that metrics from Shanice. And so now it's in like another phase of people looking at it and responding. And again, it's like, whose job is it when we're in this phase of it now being out to the public to make sure our partners are seeing it, to think about who we haven't caught yet. Because I thought, okay, we've done all this community engagement. We've really changed the policy in response to what we've heard from people. We've heard from the attorneys, we've heard from students, we've heard from partners, and then it goes to public. So anybody else who wants to talk about it and have an idea can, and then we go to voting. So I think I'm happy to do a really good job and make sure we're thorough, but I also feel like I want to know whose responsibility is it to do that, to make sure that happens. I mean, is that board member responsibility? Is that something that we ask you and Shanice to do? I mean, how does it happen that, because my understanding was with the vote, with us voting to put it into first reading, that was when other people in the community could then take a look at it and give feedback. So I'm feeling very confused about what's the sequence and because how long do we wait? And if we've already done first reading, like what's the...
Sure.
This is
that's where I am.
And I don't mean to be like to exacerbate your frustration. I mean, I think what we're highlighting is that there may be some siloing that's happening at the district. I think, I want to take full responsibility that, I've been trying to slow this down because I feel like there's a list of folks that haven't had access to this. And so, and by access, I mean, had like a specific invitation, and it hasn't been because we're not wanting to do it. I think we're sort of trying to contend with like that different departments work at different speeds. And so I apologize for the frustration.
And I know a lot of people are doing lots of things.
I think it's really important to flag too, especially in terms of engagement work around policies moving forward, and context of the time that it might take in the writing process. I think internally we've been doing this for well over a year, and before getting here. And so just naming the frustration, and also that hasn't been the culture of how policies have typically been passed in the district. And I think there's definitely an opportunity to reflect on how long the conversation might feel for us versus someone in the community who's directly impacted by it. And I think you'll have a different answer. And I think a part of our expectation and engagement is trying to help our staff reframe that some policies might be a one and done kind of conversation, but some might actually need that time in the context of operating as business as usual. I think there are some impacts to what that means in terms of closing the loop, but ultimately, I think during the pandemic, especially, there's some opportunity to reflect on how we might operate with our pace and urgency in business as it looked before COVID, and recognizing that context might be shifting. And so with this policy, I know this is a vibe, most definitely due to the fact that we, and me personally, have worked with hundreds of students and folks. But I do resonate with the chord that Danny just struck for me along these lines of the ways in which we might approach this body of work in its length. I believe we've been sitting with it for a long time because of internal, I think, capacity to need to work together that might not have always existed. But from a community perspective, I'm not sure I would name that this has been a year-long conversation. And it might have occurred with some students in very targeted ways. And so, yeah, it's definitely altogether the most progress that I've seen at the same time. So all of those truths, all of the truths, I think they exist. And would just lean into, yeah, what it looks like, especially with the context of the dynamics shifting for those folks who might be impacted by the policy. But regardless, I think we have a lot of work that we've done on it that can help ground us on the path and the direction that we might take either way.
Okay, so I'm gonna express some frustration. I seem to recall that it was definitely pre-COVID. I'm guessing it was January when we had another in a series of discussions about all of the outreach work that was going to happen. That was 6 months ago. And when we finally got to the point where we had a first reading, I was under the impression that that outreach had in fact happened. So I'm very surprised to hear today that it apparently did not. So I don't understand how we have gotten to this point where we're about to have a second reading on this policy. And I mean, perhaps I missed it, but I am very surprised to hear that there are still critical stakeholder groups out there who have not been specifically invited to weigh in on this. I don't understand. And does that mean that we're going to have to put off a second reading yet again? And don't get me wrong, do not hear this as I am not interested in working with stakeholders. That is not what I'm saying in any way. What I am saying is we do have to find a way to balance our desire to collaborate with interested parties and some of the groups you're talking about. I mean, I'm assuming who you're talking about, they definitely have an interest in weighing in on this policy. So I'm not saying we should not do that. What I am saying is that we have to find a way to do this with some level of efficiency. Maybe not speed, but I don't think 15 months in, there's any danger of this being too quick. We need to find a way to make it happen. So I don't, right now, I don't know where we are with this policy. Are we going to go forward with the second reading in 3 weeks or no?
I think, Rita, if I could help with the process here, I mean, I think that we're still in the 21-day comment period. If the policy committee, I mean, it's usual practice, if it receives substantive comments that it wants to further consider and perhaps consider amending, they come back to this committee. And I think between now and July 14th, or even, I mean, I think there's opportunity for real-time updates on what's coming in, where we can continue to move it through, really keeping a focus on the beginning of the year, but also getting that feedback that may be out there. And maybe the feedback is, no, we really like it. I mean, I don't know. Maybe the feedback is you have a really big blind spot, and we're going to be grateful we have it. But I think we have time to do it if we go fast and deliberately. And I think we can meet nearly all of the interests here in almost the time frame we need, and perhaps even exceed that. So I'm not sure it's all months and months of delay, or all nothing happens between now and the 14th. I think there is a path in between here that we can hit, and we can help support that and the feedback to committee members as that feedback comes in. And certainly, I mean, it's still open to other public members of the community who want to provide public feedback. That window's still open anyway. I don't know if that helps.
Okay, but here's my concern. We've been holding off on this policy precisely to get stakeholder feedback. And if we pass this, if we end up voting on this policy, and then we hear back from these stakeholders who I thought we were talking to, wait a minute, what are you doing? I mean, that to me is the worst of all possible worlds. I do not want to go there.
No,
So
I agree. And I think we can make sure that doesn't happen. I think what I'm hearing from Shanice is there's an opportunity to reach out. We're still within the window. Let's find out what the feedback is, and let's work to get it. And then we can figure out what the next substantive step is that's informed by that feedback. And what I hear Shanice saying is she understands that, and we all understand that we need to move. We need a policy that's better than one we have by the time school starts. And we have that, but it might even be incrementally better if we get this additional feedback. And it's the 22nd, and we have till the 14th of July at a minimum. And
this
if
is
we
what
needed one more cycle of board meetings, we would probably have that too, if needed. Go ahead.
And this is, I was going to say, and this is what the window is for. So, I mean, just what it is. I'll just flag so that nobody's surprised. I'm going to propose a different name. The more I look at it, I mean, and hopefully no offense to anybody here, because my assumption is this looks like a 1950s title. Like we're going to search and then we're going to siege, versus something that's more balanced, something like search and student searches and right to privacy, or just so it's a little more, because frankly, I don't know that people will even read the policy and like, hey, we're enlightened because we changed it. Because to me, it looks like we're setting up the rules so we can, search and seize contraband. Anyway, and that's nothing I just said is like directed at anybody, that that's what anybody's thinking. I just think that's easily how it could be interpreted in the current context of the community conversation that's happening. So I'll be coming up with proposing a different name within the time period.
okay.
Support that, Dr. Brim Edwards, and I think that goes to what we're trying to do, that it really isn't about search and seizure, it's about student rights. And I think that's one of the formative conversations we've had as we've looked at this. is how do we make this about what are students' rights?
Okay. All right. So what are the next steps? Who's going to do what?
Mary and I are happy to work with Shanice and help keep the link between the engagement and the policy process, and certainly bring in any other supports that are needed. I know Shanice's plate is very full, so we will support in any way we can across our department and other departments. We'll pull people in as needed.
Appreciate that.
And actually, and I just want to acknowledge, Shanice's plate is, her cup runneth over constantly. So we need to find a way to make all of these community engagement processes doable in a time frame that is going to work in terms of, all the various deadlines that come down the pike. And so all I ask is some clarity around what a reasonable timeline is and what can be done within that timeline. And if somebody can get back to us with that, that would be helpful.
We can do that.
Okay. Okay, it's now 5:49. We were going to do 30 minutes of discussion on OSBA. Well, that ain't going to happen. Let me stop before we go any further. So Roseanne or Kara, is anybody out there clamoring for public comment?
No.
No.
Okay. Okay. So what can we reasonably accomplish in 10 minutes that would be worth doing?
I'm not sure it matters which of those we touch on. I don't know that OSBA takes more than 10 minutes, but I'm sure we could fill 40 if we wanted to really dig deep in it. So, and Title IX regs is an update just at a high level, what those regs changed and the policies we think will be coming forward to conform to those changes. I hate to shortchange that one because I think, Title IX gets such big press. Neither of them has to be done today either. So.
Okay, so rather than give short shrift to either of them, I would suggest that we stop 9 minutes early. Does anybody object?
Yeah.
So, I guess my only thing I would say, I'm not objecting to ending 9 minutes early. I just want to make sure that if we're deferring something to another meeting, that we're really clear what we're doing next time, so that just in fairness to staff, so that they understand what's being expected of them.
So I would expect that we would bring back the discussion on the OSBA policy revision process and just make sure we're kind of aligned at a high level as we go. It's not a be all end all one-time check-in, but it's the check-in that we want to have at this stage of the process and talk about where we're going and what we're seeing. And we shared some of that last time and we just wanted your reflections. And then I think the Title IX piece going forward, I would recommend be as originally contemplated, which is a high level summary of what the changes were and then how they intersect with our
state law and then with our policies.
With our current policies. And, I think we and staff has a heavy hand in designing the agendas and trying to figure out what the time allocation is. And I think that was on staff this time. When I say staff, I mean me, assessing what was needed. And so we just miscalculated how robust the discussion was. And I think the discussions we had were important and they're the kind of conversations the committee should be having. So I regret that we were a little too aspirational on the content, but I do think we talked about the most important things first.
So I have a comment about the OSBA, is that if it would be helpful to have more information, it's just as a committee member, to have more information, like what about it? Are there some like guiding questions? Are we going to be looking at something? Just so
It's really,
we can
yeah.
provide, not wanting to blow things up, but just like what about it?
Yeah, it's really a conversation about prioritization, I think, more than anything, and to share the feedback. But we'll put something in writing for the next time. We're very happy to do that. It'll be succinct.
Awesome, like some prompts.
Yeah, perfect. Happy to do that.
Thank you.
Okay, we're now 7 minutes early. Okay. All right. Any other comments? Okay. I am going to adjourn and give you 6 minutes of your life back. Okay. Thank you, everybody.